Hello guys, welcome back to our YouTube channel PD Bros. This is me Debra on the topic hip joint. So it is a ball and socket variety of synovial joint. So the articular surface of this joint includes the head of the femur and acetabulum. Now in the articular surface, and this portion includes the neck, and the head of the femur forms the more than half of the sphere and is covered by the hyaline cartilage except at fovea capitatis. The acetabulum present a horseshoe shaped lunate articular surface and acetabular notch and acetabular fossa. So this is the acetabular fossa and this is the acetabular notch, and it is occupied by the transverse acetabular ligament. Now we will discuss about the ligament of the hip joint. There are total of 7 ligaments in the hip joint, and this provide stability for the hip joint. So the first ligaments include the fibrous capsule, and this is attached to the hip bone on the acetabular labrum, including the acetabular ligament, and to the bone above and behind the acetabulum, and on the femur to the intertrochanteric line in front and 1 cm medial to the intertrochanteric crest behind. And the anterior superiorly it is thick, and posterior inferiorly the capsule is thin and loosely attached to the bone. Anterior superiorly it carries maximum tension, and this capsule is made up of 2 types of fiber. The outer fiber are longitudinal and inner circular one, and it is known as the zona orbicularis. The longitudinal fiber are best developed anterior superiorly, where many of them reflected along the neck of the femur form the retinacula. And now let's discuss about the next ligament, that is the iliofemoral ligament. It is a inverted Y-shaped ligament of the bigelow, lies anteriorly. It is one of the strongest ligament in the body, and it prevents the trunk from falling backward. And the apex is attached to the lower half of the anterior inferior iliac spine and base to the intertrochanteric line. Upper oblique and lower vertical slips are very thick, and middle fibers are thin and weak. And now the next one is the pubofemoral ligament, and this supports the joint inferior medially, and it is triangular in shape. Superiorly it is attached to the iliopubic eminence and obturator crest and obturator membrane. Inferiorly it merges with the anterior inferior part of the capsule with the lower band of the iliofemoral ligament. Now the next ligament, that is the ischiofemoral ligament. It is comparatively weak and covers the joint posteriorly. The fibers are twisted and extend from the ischium to acetabulum. The fibers of the ligament form the zona orbicularis. Some of them are attached to the greater trochanter. And now the next ligament, that is the head of the femur and round ligament or ligamentum teres. It is a flat and triangular ligament, apex attached to the fovea capitatis and base to the transverse ligament and the margin of the acetabular notch. Now the next ligament, that is the acetabular labrum. It is a fibrocartilaginous rim attached to the margin of the acetabulum. It narrows the mouth of the acetabulum, helps in holding of the head of the femur in position. And the next ligament, that is the transverse ligament of the acetabulum. It is a part of acetabular labrum which bridges the acetabular notch. Now we will discuss about the relations of the hip joint. Anteriorly it forms the femoral artery, femoral vein and femoral nerve, and tendon of Ilio separated from the joint by a bursa. Now in the posterior relations, it forms the tendon of obturator externus covered by the quadratus femoris and obturator internus with gemelli, piriformis, sciatic nerve and gluteus maximus muscles. Now in the superior relation, it is by the gluteus maximus, medius and minimus and the reflected head of the rectus femoris muscles. Now inferiorly it forms the hamstring muscles and adductor magnus, adductor brevis and adductor longus and gracilis muscles, and it also forms the pectineus muscle for the inferior relations. And now for the blood supply. The hip joint is supplied by the obturator artery to circumflex femoral artery, that is the medial and the lateral, and two gluteal arteries. And nerve supplied to the hip joint is supplied by the femoral nerve and through the nerve to rectus femoris and anterior division of the obturator nerve. And the movement of the hip joint includes the flexion and extension occur around a transverse axis, adduction and abduction occur around an anterior posterior axis, medial and lateral rotation occur around a vertical axis, and circumduction is a combination of foregoing movements. And that's all for the topic hip joint.